Hi, I'm Dr. Chol Kim, and I'm an orthopedic spine surgeon in San Diego, California. I specialize in minimally invasive spine surgery. This is one of my favorite topics in spine surgery, and in particular, using the laser during endoscopic spine surgery. Here are my disclosures. I am a consultant or a speaker for Eloquence and Lumenis. I know that some of us look at laser spine surgery as somewhat of a gimmick, in part because we have the experience of the Laser Spine Institute that was very aggressive in their marketing. I do use the laser during endoscopic surgery, and I want to explain to you why it is that we use it. I'd like to start up by reminding all of us that lasers are commonplace in medicine. We use it in eye surgery, so originally radial keratotomy was a very uncomfortable procedure. Now it can be done quickly as a same-day procedure, almost a zero recovery period with much better results. Same thing with plastic surgery and dermatologic surgery. In the olden days, they used to use a sandpapering machine called dermabrasion to remove the dead outer layer of the skin and initiate a re-healing response. And now they do that with the laser because it's much more controlled and there's much less damage and much shorter recovery. And same thing with urology. The use of the laser has either become standard of care or is commonplace. So why do I use the laser in spine surgery? I want something that I can get to a surgical target site even though it is right next to a really important nerve. And I want to be able to treat tissues at various distances from my working channel, so I need it to be versatile. I think those two words are somewhat contradictory. It's almost like asking for the best of both worlds, but this is what the laser allows us to do. So here is a normal looking dollar bill. Using the medical grade YAG holmium laser, you can take off the paint from this dollar bill without penetrating the material of the dollar bill. What else you can do with the medical grade laser? Make a circular set of pinpoint holes around the eye of George Washington, and it looks like he's wearing cool Elton John glasses. Look at the close-up. It is amazing how precise the laser can be targeted and how you can control the amount of energy that it displaces. Let me just explain to you through a typical case example why is the laser. And you can kind of see with these big Mickey Mouse ears, he probably has a very deep seating pelvis, so I had to do an interlaminar technique. And with the interlaminar technique, you are right up against the traversing nerve root. So if the disc herniation is stuck really tightly, it can be quite challenging to get that whole disc removed. So here is an intraoperative video of me using the laser, and this is an interlaminar technique. So I've got the endoscope almost at a 90-degree angle to the surgical target site and the dural tube going east to west. And you can see, if I were using an electrical instrument, I am so close to the dural tube that electrical conduction could potentially stimulate the exiting nerve root or the traversing nerve root. And if the patient's awake, they will jump off the bed and they will not be happy. If they're not awake, they'll still jump off the bed and potentially could irritate the nerve, and it could stay irritated for a few weeks. If you use a mechanical instrument and there's a lot of adhesions and you cannot get it off, you could potentially grab a piece of the dural membrane, which is really thin sometimes, especially if it's been adherent to the extruded disc herniation and there's lots of inflammation, and you can get a durotomy as well. So the laser allows me to work very close to the nerve. So when somebody says, why do I use the laser? I guess the simplest way, if you play golf, and I don't play golf that much, but I think golf has lots of great analogies, but if you play golf, it is like my 60-degree wedge. It is when I need to make a very precise shot right at the edge of the green get it close to the hole so that I can save an up and down there. And for you golfers, you know how important that is. I have the worst record for greens and regulation. I am just all over the place. So I have to rely on a really good up and down to kind of keep up with my friends, and especially my younger brother, who's beats me every single time. It's so frustrating. I always say, why am I such a better golfer than him, but he keeps on beating me? That's why you need a really good short game, and I hate practicing that. So I have a really good short game club. So check this out. This is Tiger Woods 2012 Masters. The water is like the traversing nerve root. The grass in front is like the exiting nerve root. And the working triangle is right here. He's got to land it right there. Look at this. You do not have to be a golfer to appreciate that shot. So when people ask me why I use the laser with endoscopic surgery, it is one of many very specialized tools that allow me to address all the different pathologies in the most versatile, precise manner that I can. And thank you very much for your attention and for having me as part of this really interesting, thought-provoking, and cutting-edge program. Please feel free to check out my YouTube videos and follow me on Facebook and Instagram for more videos on various minimally invasive topics. Once again, thank you so much.